In mental health conditions, oftentimes people have a variety of comorbidities, and as you mentioned, 1 in 5 or so. I forget whether it was at any point or at some point. Bottom line being, many of us will have a mental health sort of episode of some sort. It might be short-lived, might be longer-lived. Sometimes people have anxiety, depression, other mental health conditions, certain diabetes, cardiovascular disease, obese, overweight. So a lot of things that are comorbid.
Right, or alcoholism, drug addiction.
Yeah, exactly. Curious as to whether the test itself and the matching to the appropriate drug is genetics enough, or is it a combination with genetics and these other kind of comorbidities as well?
Well, I think it's a good question. Again, a little out of my wheelhouse, but from people that I've interacted with, it's getting on that right medication and with therapy and sticking with it, that if they feel better, they seem to have the ability to the things like maybe the drug and alcohol abuse tend to wane a little bit because they are feeling better. And to your point, though, with diabetes and things of that nature, we're also looking at polypharmacy issues by trying to analyze the drugs that are commonly prescribed in their interactions with the 3, 4, or 5 other drugs people may be on. Because sometimes what you find is they can counteract each other, and we certainly don't want that.
Yeah, no, interesting. Where, I think in a nutshell, my understanding of that would be that, the drug itself relative to the genetic marker might be the right drug if nothing else existed.
Right.
But if you have comorbidities, you're taking other therapies, you need to factor that in as well.
Absolutely. And again, it's sort of that looking at the whole person. And I think that's where you see some of the medical practices are nice because they may have a psychiatrist, a family doctor, somebody who handles diabetes. So people have to be treated as a whole and hopefully don't have to run from one doctor to another, that everyone's located in one building and try to get treatment for everything in one time, one location.